Hello, everyone. My name is Dawson, and today I'm joined by Pathio members here, Shagzoda, Michael, Diora, Ivy, and Sylvia. And I'm really excited to introduce here with us today, joining us for a panel, Abdullah. He's currently a first-year student at Ithaca College, and he'll be talking about his prior experiences today, working as a medical assistant in a wound care setting, and also as well as a vascular medicine setting. So with that in mind, I'll give the platform to Abdullah to introduce himself.
Yeah, hi guys. My name is Abdullah Hafeez, and I am a first year PA student in Ithaca College. I'm in my third semester out of four. I began in August. It's almost coming up to a year. Just crazy. I was born in Pakistan. I came here in 2010 with my family, just for education purposes. And um, yeah, I went to college in Hunter. I completed my undergrad in human biology. I got my bachelor's in human biology. And yeah, currently pursuing my master's in physician assistant studies. Um, I previously worked in endovascular interventional radiology for endovascular, and I work with a wound care physician in multiple nursing homes. I was a medical assistant. I started off as a scribe, went into a medical assistant. I was managing the patients with the surgical coordinator of our endovascular practice as well. So I got to see a lot of wounds. I got to see a lot of peripheral arterial disease and venous insufficiency. And yeah, just pursuing physician assistant as, the next stepping stone into medicine.
See, very inspirational. So one thing I want to start off the first question of this panel is with what led you specifically to the physician assistant path, and what made you choose it over the other healthcare careers that are available?
So I think that physician assistant is sort of chosen as like a lifestyle balance thing. Basically, I did explore other avenues. Like I looked into nursing, I looked into, going to med school and things like that. When I was in Hunter, I was pre-med to begin with. But that's, I think, more so because I also didn't know what physician assistant was. It was during my sophomore year that I sort of found the path, just speaking with a few advisors and things like that. But I chose physician assistant because it allows you to have a lifestyle balance within medicine. It allows you to be in a team-based healthcare approach. So you're going to be working with other nurses. You're going to be working with specifically, you're going to be working under a doctor, but you get to have your own patients and diagnose, and you could get to learn from people that are specialized, such as a physician that you might be working with. But I also like the fact that there's so much lateral movement. You're able
Mhm.
to work in different specialties, work with different patient populations, and that is something that was intriguing to me because I'm not someone that's like can just do one thing at a time. Like just from my work experience previously as well, I love to learn about different things, and I think physician assistant is a sort of work where you can do multiple things at a time. You can learn a lot. It's lifelong learning. That's how it's been described to me always. So I would say the lateral movement, the lifestyle balance, that's something I learned with actually working in medicine, working with nurses, working with physicians, MDs. It showed me that this is sort of the lifestyle I wanted.
So,
You immigrated from Pakistan to the US and grew up in Brooklyn. How did your background and family journey influence the way you thought about education, healthcare, and your future career?
So in Pakistan, I mean, I was still pretty young, but I even the times that I've gone back to Pakistan, there's obviously health disparities everywhere, with their based on your socio-economic status and things like that. So I sort of two reasons that I think my background is pushed me to this way is because I have seen a lot of um, health issues go not managed because people may not have had the means to uh, seek a provider within Pakistan. I mean, it's very much like you need to have money to be able to go see a doctor and things like that. So I think that's something that pushed me to pursue medicine because I wanted to be someone that can provide healthcare to anyone and everyone. And that's similar here. It's people not if there's somebody that's not able to get just medical knowledge that could potentially save their life, or just, educating patients on simple things they can do to um, eliminate chronic illness in the future. It's something that I want to pursue. And other than that, I think that uh, my seeing certain diseases or chronic illnesses such as, cardiovascular disease and things like that within my own community sort of pushed me into this, because something I spoke about with a lot of coming into this program was my community has a huge problem with cardiovascular disease. And to me, the way it's been explained to me is that it sometimes had to do with our lifestyle habits and the foods we eat and things like that. So, from my own parents and grandparents, a lot of times they go to physicians and they don't necessarily know what they're talking about. It might be like a language gap and things like that. So I want to be someone who can speak to his own community. Like, I'm able to speak the language. I'm able to explain things to them. I know how the foods we eat. I know the things we do. I know our like habits. So I want to bridge the gap in that way and be able to educate my community.
Abdullah, what was your undergrad experience like, and how to prepare you for the PA path in terms of decisions, classes, and experiences? And say that hour count too, because people need to hear that.
Say what?
Say that hour count, the hour count.
The hour count. Oh, so in terms of undergrad in Hunter, it was very rigorous for sure. Um, During the time I was there, it was always also COVID, so that was a huge change that I had to adjust to. We began with, you know, undergraduate classes and you're coming into college and you also have to adapt anyway. It's not like middle school or high school that you've been learning. Everything is different. Classes are bigger. Um, you don't get individual attention, so it's sort of on you. I think I had to learn that sort of you have to find your own way to learn, and that actually translates into PA school perfectly, which I can talk about later as well. Um, the science courses were very rigorous, and it's like you have to take the extra step to teach yourself and be capable enough to teach others. I think that's sort of the path I took. If I can explain it to someone, then I that's means I truly know it. Um, but I went through ups and downs in undergrad as well. That was just a learning curve. I had to learn how to navigate big classes, how to navigate such a big volume of courses and the big volume of information that is being thrown at you. Um, uh, you begin with just regular courses when you're trying to find out what you really want to do, and then you specialize, you take specific higher level courses, and those courses aren't anything like what you have previously. So again, it's just adjustment and things like that. That's sort of translated to PA school because it's like the amount of information I had in colleges was overwhelming, and then this is triple that amount. And you just have to adjust. But I think that the more time you spend within college, it prepares you. At least it did for me. Being able to be independent or figure things out on my own is what I learned from undergrad.
Adding on to your undergrad years, what did you do during those times that helped you with your PA application? And knowing what you know now, what do you think you would have done or like approached differently?
So in undergrad, like I was saying, it was during COVID, so all our classes went online. So I guess that's what I should have added, is that it was tough to adjust to COVID learning because now everything was online and the tests were in a different way, the formatted different. I think that was sort of the time when I knew I wanted to go into PA school. And the big thing about PA school is you need a lot of experience. I think that's what Michael was sort of hinting at. You need to have patient care hours, and you need to have different organizations you want to be in, sort of to show your interest within healthcare. But to me, it's not really about interest, it's more so about understanding what healthcare is. And you won't really learn what healthcare is unless you work within healthcare. I know I really had a different idea of what it meant to be with patients, what it meant to um, be able to communicate diagnoses and work with in an interpersonal relationship with different like nurses and doctors and things like that. That was sort of something I learned only because I worked in healthcare. I was part of organizations such as NMDP. Well, it was called Be the Match before. Now it's called NMDP. It's a bone marrow transplant organization. So I was an ambassador. We would set up tables and we would basically just either outside or within Hunter itself, just try to educate patients, be able to get them to do swabs to be part of the registry, that in case down the future someone is a match for them, then we can sort of call them. I think those are the type of things to focus on, but patient care, healthcare experience, which can be very general, patient care and healthcare hours are different. But that is sort of, I think, what helped me more so just solidify that I wanted to go into medicine as opposed to, be a checking the box kind of thing. And there are a lot of opportunities in undergrad. You just have to become someone who seeks these things out, because I wasn't as much that person. It was sort of these things fell into my lap because I either had friends who were doing these things, or friends were telling me to do these things. So there are a lot of opportunities. Don't just be, confined to your college. You could go into any CUNY and things like that. There's a lot of opportunities out there, and just seek those uh, either work experience or organizations, such as things you guys are doing already. These are the things that you should be focusing on.
So, going into your clinical experience, you worked as a medical assistant with Dr. Uche, wound care physician in many nursing homes in Brooklyn, as well as some underserved population in the Bronx. How did that experience shape your understanding of patient care?
Uh, that was probably the best experience I could have done. Uh, just the Dr. Uche, the physician I work with, he's incredible. He's very understanding. He's very patient focused. So I think he was a great mentor in setting me towards the type of person I want to be. And so basically, what my position was that I began with him as a medical assistant, began as a scribe, and then we got another scribe within our team, and I sort of became a medical assistant. But we service, I think when I started, it was 5 nursing homes all around Brooklyn, all around New York, and specifically one in Brooklyn. And it was a pretty big facility. We dealt with mostly pressure ulcers, diabetic foot ulcers, DTIs, deep tissue injuries. But this specific nursing home was very, very rough because of COVID. And this was actually an opportunity I got during COVID because I was having a very tough time because during COVID, no one was hiring. I saw Dr. Uche's opportunity in one of the school emails, and I just sort of jumped at the opportunity to do something hands-on. My job consisted of preparing treatments, preparing patients, getting just the treatments ready and the room ready for the physician to come in, measure wounds and clean the wounds and help him with putting the new treatments on. And I think I learned, first of all, that was the first time I spent speaking to patients. That was the first time I got to touch patients. I was making treatments. I was the one, in charge of setting up the room in the most effective manner for the physician to be in and out. We saw up to 80 patients a day within that one facility. It's like these patients had multiple wounds, so you have to be able to understand where the patient needs to be in order for the physician to see the wounds. You need to know where to place all the treatments for it to be, because these wounds hurt so much for the patients that you want to take as little time as you can, so they can be in a resting position. So what this job showed me was how to speak with patients. Bedside manner was the biggest thing. You you need to learn how to speak to patients. Like, you need to be able to articulate yourself, what you're doing, but then also put them at ease, because if you put yourself in their shoes, this is just someone coming in to, touch a very, very sore area on them, and it hurts, and you need to be able to trust the person that's there. So, um, uh, I think that was the first thing it taught me. Another thing was that we didn't necessarily always have the right, uh, not the right, but we didn't always have all the equipment necessary. Like we had to adjust with what we had. And what Dr. Uche taught me was being able to adjust on the fly to, again, use your resources that you have. Might not necessarily be the most optimal thing you need at that moment, but anything is better than nothing. And you're trying to save these patients from any uh, other infections or anything more serious. So I would always watch him go outside into our car and look through what we had to see how he can best help this patient at that moment. Um, and it's not just things like that. It's also being able to hear him speak to patients and patients' families. I think that's another big thing is uh, the way the physicians I work with, they spoke to families really taught me that, you're managing patients as one, but then you're also managing their families and teaching them why you're doing what you're doing. And again, it goes back to building that trust. We saw these patients just once a week, but that's that you need to build that trust within you and these patients, because then they'll actually allow you to best take care of them. And obviously, you need to be able to articulate what you're doing anyway, because why else are you doing it? So yeah, I think being able to talk to patients, learning how to talk to patients, learning how to talk to families, and then in general, learning about the wounds, learning about the etiologies, and learning about the symptoms and things that come up. That in itself is very important. Yeah.
Awesome. Okay, you later worked at an endovascular company. So what was your role there, and what were you able to learn from that position, whether about the chronic disease, follow-up, patient education?
Yeah, so after I worked with Dr. Uche for a bit, we obviously saw a lot of wounds like diabetic foot ulcers and things like that. That sort of got me interested into endovascular because Dr. Uche was always referring these patients for vascular procedures and things like that, because blood flow and wounds sort of go together. You need to have proper blood flow in order to heal these wounds. And it was always sort of the wound care team and the endovascular team sort of always went hand in hand, because you needed one for the other. You needed to have good blood flow in order to heal these wounds. So I got interested in that. I seeked an opportunity in a company that was very big within the New York area. I started off as a just like an aid for transport. I would take these patients for their procedures. I would go into nursing homes, take them for the procedures, help with pre-op and post-op with the nurses, and I would bring them back. After a little while, I was seeking a little bit more responsibility, so I started to go with physicians and nurse practitioners to these nursing homes. So we would see patients for consults, any patients that came into nursing homes, which this company serviced. Um, we would do the consult, listen to their pulses, look at the wounds, measure them, and things like that. And my role was sort of to clean the wounds, because that's already what I was doing with Dr. Uche. My role was sort of scribe for them to get patient information and things like that. Um, After being with the providers, we also started expanding into assisted livings and things like that. But my role sort of expanded from there on out. I was going with more and more physicians while I was doing also wound care on the side. Um, the nursing homes, we would just go and do follow-ups for procedures we had already done, go listen to pulses, make sure that the procedure worked, making sure that the symptoms that the patient were feeling were getting better. And, it allowed me to manage patients with a provider for a long period. Like I have seen a lot of patients progress to the point where I genuinely saw their wounds healing, which is tough, because I think Dawson can also see, we've seen wounds for like for a lot of patients that have been there for years. It's an ongoing battle, and being in endovascular actually showed me how these, you have these wounds, and then you help these patients with endovascular procedures, and the blood flow returns, and you're able to see a genuine change, and you're able to see the wounds heal. So I think what I got from this position was, first of all, anatomy. It really allowed me to know the vascular um, anatomy of the body. It taught me how to uh, a different aspect of medicine. Like now I was looking at blood flow, and I was looking at the things that can go with that. I was actually able to watch a few procedures during my time as well. I was in the OR with the interventional radiologist while they were doing procedures. So sort of just a shadowing opportunity, but it really just connected everything for me, from being able to manage the wounds with the physician, Dr. Uche, and then going into the endovascular scene to see how we can further improve the wounds coming in.
I mean, there's like a very common notion among PA students and even like healthcare people or like pre-MDs, right, about getting clinical hours. And we can see like from your experiences and from your background, you have a lot of that. But personally, what do you think it means for students that are trying to get like patient care experiences, like before PA school, MD school, whatever their track might be? Like, what should they focus on besides just checking off that box of just getting those hours?
I think it goes into like what type of experience you're really going for. Obviously, like every school has different requirements and things like that, but I think my my like ideology sort of changed. Like when it was during COVID, all I wanted was like a position. I just wanted a job to like put my foot in, but it needs to change from just getting hours into what you're learning, because uh at least what I find is that when I'm working hands-on, I learn a lot more and I retain a lot more than when I'm, just studying. Obviously, like you're gonna know these things, but when you see it on an actual person, it really, really sits with you. So I think that anybody in any sort of track should really look at what opportunity is going to give you a lot of responsibility, obviously, which needs to be earned. Like you can start off as a scribe and things like that, but you need to seek that responsibility. Like I was just a scribe previously, but then I requested to go with physicians to be able to see these patients in the nursing homes
Mhm.
and things like that. So I think that the opportunities you look for, you need to look at what you're going to get out of it. Are you going to be able to see patients? Are you going to be able to talk to patients? Are you going to get hands-on experience? A lot of my classmates worked in the ICU. A lot of them worked in dermatology. They actually were able to see PAs and MDs do procedures, that you learn a lot from that. Just the fact that you're setting up a room for a procedure lets you know, because you know exactly where everything needs to be and what the function is of that thing, any instrument or any bandage and things like that. So um, I think that's sort of what needs to be focused on, and having, at least what I think is that you need to have a general uh, patient care experience. Like a lot of the students that are here with me, sort of, I have a little bit as well. They have a little bit into everything. They've worked in dermatology, ICU. They've worked in um, oncology and things like that. The more diverse experience you can have is always better. But yeah, you need to make sure that you're actually using your time. If you're with a physician, you can pick their brains. I think when I was with Dr. Uche, we would have sort of 30-40 minute conversations after rounds, just like us asking him questions. Like, we did this today. Like the one of the first things I remember is it was the first time I saw a wound vac and uh to put on a wound. And when you have all the stuff there, it looks daunting, but you realize what each thing is and what each thing is for, to the point where you by your third or fourth time you can set it up yourself. But that was only because the physician that was with us was able to answer all the questions, explain why we're doing what we're doing, just like he would for a patient, he was doing for us. So I think mentorship is very important. Seek the opportunities where you're going to be able to do a lot, but then also learn a lot from the physician themselves. And I think that's sort of a good way to go.
As for the application process, what was the PA school application process for you, and what parts of your application do you think made the biggest difference?
So PA applications, or well, any applications for any school is, it's a very scary time. Um, it's you're nervous because whether you're taking time off from between college or not, it's very daunting to like you want to get in and you want to exemplify your applications as much as you can. For me, it was tough because I genuinely thought I did not have enough experience because of the things I was listening. Everyone's online and they read things through Reddit or whatnot, but it's like, oh, people have like 5,000 hours and things like that. Like, how am I going to compete? But I think that if you're within college, you just do the best you can to exemplify your application. You do your hours, no matter how many you have, like diverse experience hours. You have to keep your GPA up. You need to make sure you're taking the right courses that your program requires. Um, I also did certifications in phlebotomy and EKG. So, those things help you to exemplify your application. But it's a stressful time. I mean, everyone I speak to, like, I sort of just applied out of nowhere, randomly, very, very randomly. I applied, I think, 2 weeks prior to the deadline for this program. Not recommended. That's not something you should do at all. And you need to apply to a lot of schools. Obviously, there's a financial aspect to it because each application costs plus supplementals and things like that. But the only way sort of to get past the stressfulness of it is to be ready way before. You need to have everything in way before. When you're working with physicians, you see um how busy they are. They're a lot of times they're gonna forget. You're gonna be constantly asking them, and don't feel bad about it, but you're gonna be constantly asking them for letters. So CASPA opens in April, I believe. And I think it's like 3 months before you should have everything like set up in terms of your letters and things like that. I think that you should have all of that ready already so you're not stressed at that time. But I think just what I did in terms of thinking that I didn't have enough hours, things like that, you just need to sort of commit. Like as long as you're doing the work, you're keeping your GPA up, you're getting enough patient care hours. Yeah, you should definitely just get everything ready and apply. Just have everything ready for April and apply right at the date. That takes a lot of research. You need to be able to look into every single program individually, see if you have the classes that they need. And that actually starts now when you're in school and you want to go down the PA path. There's some courses that aren't required for some programs. And if that's a program that you really want to go to, then you need to write down. That's what I did. I wrote down all the programs that qualified for all the classes that I took and the hours I had. So it is a stressful time, but you can decrease the stress by being prepared. And the earlier, the better. I sort of rushed it at the end, but it worked out. But that has not been the case from anyone I've talked to within my program. Everyone either applied 2 or 3 times. Thankfully I got in on my first try, but a lot of sometimes it takes a few applications, and it's very important not to get disheartened because you will get through it. Like it's just that PA profession is becoming very, very popular and it's becoming very, very tough. And so you just need to do what you can to put your best foot forward. But yeah, be prepared is the only thing sort of I can tell you. Yeah.
I know you talked about being prepared, but is there anything else you think that PA school applicants underestimate? about the application process?
Um, I think it's like how quickly everything happens is sort of the biggest thing. It's like you're obviously like thinking about all these things you want to do. Like you need to have your personal statements ready. You need to have your letters of recommendation. Like it took me a long time to get letters of recommendation from people. And uh if you're in science courses and things like that, and you've done really well and you want letters from your professors, like don't think that the professor is going to remember you 3 years later or 2 years later. So you might email them and be like, "Hey, I was in your class on this random time, and then can I get a letter?" Like you should be getting those things from them or staying in touch, and that things like that. It's also about reviewing your personal statement, highlighting the things that you want to highlight. I think like sort of the personal statement is also a game where you need to put your best foot forward and like, okay, this program is very, very focused on this aspect of PAs. Like you need to exemplify those things, right? In your personal statement. In terms of the process, it's like once April comes, it's like everyone's applying. And I think I was speaking with a friend of mine who got into PA school, but it's like when everyone else applies, you just feel behind if you haven't done it yet, right? So I think being prepared in prior to that deadline is what is the best way. But have your personal statement ready, letters of recommendation ready. Within that time, make sure that you're constantly getting your patient care hours, your healthcare hours. Researching, I think, takes a long time, a lot longer than people realize, because you need to go through what you have and then you need to go through what programs match with it. So look into the courses that require, the amount of hours they require, and don't be open-minded and going everywhere. I think I sort of applied just in New York, but I think there's a lot of great programs everywhere, and don't just hold yourself sort of confined to an area because um, there like you can get a great experience in a lot of places outside of New York as well. But it that just takes research. And I think one of the biggest things I didn't do, which I would advise people to do, is go to workshops. There's always workshops. So if your college might send out things where either schools are coming, medical schools are coming, or PA schools are coming. Um, you need to be able to make an impression in front of these people that are coming in, and just to go and get information if it's even suitable for you, right? Like it's not all about the program. You need to be comfortable. You need to like the place you're going to, and I think that's sort of an important aspect to look into as well. But yeah, it's a stressful time, but I think preparation is what gets you the best result. And just exemplifying your application through diverse experience and matching it to the programs that uh, work for you.
Okay, so I know you're currently in PA school, and I believe you finished your first year. What does your day-to-day look like in terms of classes, exams, workload? Do you have time to do like any hobbies outside of that? And what has been your biggest academic or personal adjustment so far?
Um, yeah, I mean, day to day is like, you have classes almost every day. You have like exam blocks and things like that. So my day to day is sort of from 8 to till 12. We have classes that could be like multiple classes, and then lunch, and then you go come back for classes until 4 or 5. Depends on different days. This semester, it changes. Like last semester, it was nonstop. Like, it was a very tough semester where it basically for 4 months you really had no time. You can make time. I mean, actually, you can make time. Absolutely, you can. It just takes organization. But this semester is a little bit different where we get a little bit more time in between classes as well. So it depends on the modules and things you're doing, but usually it's five days a week. It has been so far. Um, but after that, it changes through each semester. Ithaca is a very upstate New York, I never even knew, but it's like it's such beautiful nature out here. So I think what a lot of people do is we have sort of a group that does like hiking and things like that in the summer. There's a lot of things to do. We just started like a pickleball thing team thing. So we started been doing that. So you can't I haven't gone out that much, but there's a lot of you need to be able to distract yourself, from the studying. I think that we you're taking such a heavy workload that you need to be able to separate yourself from it for a little while, just to give yourself a little bit of a break. So breaks are huge within your day to day. Well, so like some people do is like they'll take Saturday completely off, like don't do anything on Saturday so that they can just recoup for that one day. Um, and yeah, just people go outside, we hang out as our cohort. Thankfully, our cohort is like very, very connected. Like we ever since day one, I can speak to anyone within my cohort. We, hang out and things like that. Unfortunately, even when you hang out outside, it just becomes talk about, how stressed you are. But uh, it's nice to get away from your studies and things like that and focus on something else. In terms of the biggest thing I've learned so far in the program is how to adjust to studying. I think like within undergrad, you can sort of get away with it in terms of like studying the same way for each course a little bit. Um, that has not been the same for this because each course is like completely different. I sort of had classes, so we have like clinical medicine, which is essentially modules of different systems. So you have respiratory, you have cardiology, we're doing orthopedics or rheumatology. Each module has been completely different for me of how to learn. I'm someone who writes their notes, but the amount of information we're getting, you really can't. So in one module, you might be like watching, taking resources from outside, watching videos and things like that. In another, have to draw mechanisms. I think the fact that my studying changes every single module is the most difficult thing to adjust to. Um, and then time wise, everything is compiled very, very close together. So you might only have like 2 weeks to learn, as much as you can within a single module. And that's just clinical medicine. Then you have, pharmacology, you have pathophysiology, you have physiology for one of the first semesters that I had. So adjusting the way you learn for each course is probably the toughest thing, but it can be managed. And, I have people within our cohort that, again, they're able to manage their time so well that they completely they're able to go on, some trips outside or something like that. They're able to take some time, and you get time between semesters, and that's your time to regroup and like start again. So, um, I think time management at the start, you need to understand like, okay, I have this sort of week and a half that I'm like really studying, but within it, take some time, like take a walk, whenever you need, go hang out with friends that from your cohort or wherever you are. Um, all of that stuff is very important. But the one thing I've learned is like I've had to adjust my studying for every single class. And that if someone doesn't know that coming in, that might be a little tough, but definitely manageable.
So, looking back at your previous clinical experience in like wound care and interventional radiology, how has that helped you in PA school, whether that be in learning patient assessment, communication, or clinical reasoning? I know a lot of the PA students that used to work as medical assistants in my dermatology office said that their dermatology rotation was like the easiest for them and they like passed the exams better because they had so much experience in that already. So I want to know how that has helped you.
Yeah, absolutely. So obviously me working for wound care and endovascular, it's been very helpful. Like as soon as someone comes in with like cramping and things like that, I'm just like, oh, okay. It's like yeah, there's some things that you're gonna be very good at, which sort of goes to my point of having a diverse work experience, because the more you learn within your health experience, it'll just help you when you get to it. Because yeah, we have a lot of people within our cohort who did dermatology, and then it's like when we got to derm, and I have to look at 60 different skin conditions, and I'm like, what's going on here? And then, my friend she just knows all of them, and I'm like, yo, it's not fair. But everyone has their own expertise within it. But my sort of way to look at it is that I just learn from them, because I know that they know how things present most often. And so you get a group, like we've done this a lot actually, where let's say somebody who had worked in dermatology for like 4 years prior to coming to PA school, we're like, all right, well, we know this information. Can you just like explain like how you've seen patients with this? And that just helps make it easier for you. But absolutely, like when we're talking about wounds, or we're talking about endovascular, or you know, um, distinguishing like say neurological versus muscular defects, like yeah, I have a little bit of background within it, so I'm able to add to that conversation or help my classmates with understanding how I've seen it within practice. In the same way, I have people within our cohort who worked in ICU and ERs, like they've seen such a vast variety of things that they're able to give their input into every little thing that we do. And it very much helps me to understand. In terms of the clinical reasoning, my experience has like going from wound care into endovascular, it helped me to tie those two things together. Nothing really ever is like just one thing. Like you need to understand that like this is sort of something that we've been taught now, where you need to see the patient as a whole, and they might not just they're coming with like something acutely like an acute distress at that moment, but it's this whole patient as a whole who might have other chronic conditions and things like that, and you need to tie that into your clinical reasoning. You need to be able to think why one of our uh, the one of the doctors who was used here, she made a really good point. It's like dominoes, where one thing is like starting it off. You might be focusing on the third domino, but that's not the cause of it. It's the first one. It's just that you're seeing the problem presenting to you is the third domino. It's just you need to fix the first one. You need to fix what started it. I think that when I was working with Dr. Uche, that helped me, because yes, we're sort of focused on the wound care, but these things are happening because of comorbidities of patients. Um, uh, let's say because I worked in the nursing home during COVID, so many patients were bedbound that they ended up developing these, ulcers. Now, if I come in for the first day, I might think that the ulcer is the first problem, but it's actually they're being immobilized within the bed, not being turned enough and things like that. That's what causing it. So you need to understand that, you might be seeing it, you need to manage a problem, but you need to look at the actual first domino that went down. So I think the more experience, the more diverse experience you have, that just puts you in a great position, because at least for me, seeing things in practice really helped me to actually understand them. And if you can have that diverse experience for a bunch of different specialties, you'll be in a very good position, and you can teach others, and I think that helps a lot as well.
Just want to go back to the point, sorry if I missed this. So like in terms of like your schedule or your blocks in PE school, so like if you could touch upon like during like your first year, are you in the classes learning about like the different theory about like medicine? Do you solely in the second year solely trickle into seeing that in person in clinical rotations? Or does that go with hand in hand where you have you're sitting in the classes, and then the next week you're seeing patients in the hospital or the clinic?
Yeah. So I think for PA schools, at least the ones that I know of, it's always didactic and then clinical. So My program is 27 months. Most programs are usually 24 months. So for the first 12 months, you're going to be doing didactic, and then for the next 12 months, you're going to be doing clinicals. So within the way my program has been set up is that first semester was, you have like genetics and microbiology, and you have certain courses of like looking at x-rays and imaging, and you sort of get the lay of the land. Second semester, we went into like an anatomy lab. I'm very thankful that my program had actual cadaver lab. So we did for 2 months we did a full cadaver, able to see all the organs, able to see all the nerves, brachial plexus and things like that. It really like sat with me. So the first year is, I think, going to be classroom based and things like that, which is good for most people because that's what you're coming out of, or you're at least adjusting to it. Let's say you've taken some time away from the time you graduate, like you need a little bit of time to get back into it. Obviously, you're not going to get that much because it's very, very accelerated, but you get back into a classroom, you're able to see different courses. The most important, I think, is clinical medicine, is when you actually start to see modules of different specialties that you would have, such as cardiology, um, respiratory, and dermatology, infectious disease, things like that. So that started within my second semester. The first semester really allowed me to get back into studying because I had also taken a year off. So it allowed me to adjust to studying again. And this third and fourth semester, they just continue. You get more and more clinical medicine, you get pathophysiology, you get pharmacology, and we also do evidence-based medicine, which is very interesting. You learning research and things that are coming up at the current moment. So after you've completed didactic, you move on to clinicals, and clinicals you have specific rotations you have to do, which is like family medicine, internal medicine, uh, I believe psych, and you will have women's health. That's one for my program as well. So that second year is for clinicals. You go on rotations for 5 weeks in each specialty. And that could be different for programs right now. This is not all like a mold for every PA school. Every PA school is going to be different. But that's sort of how it pans out. You're sort of in the classroom for a year, and you're learning these diagnoses and different pathologies. And then obviously you're supplementing that with actual connections to clinical medicine. The physicians that are teaching you and things like that, they put it into context, but actually patient care you're going to do in clinicals.
Sounds good. So my second question is, I have a second question. It's a little different from the last question I had. So like from speaking from your experience, having all those clinical experiences on your belt, like what do you think that patients or families that they might have misunderstand about like chronic diseases, whether that be like pressure ulcers or just in general, like how to prevent them or how to follow up with their healthcare providers, like having been in medicine now and going into medicine?
Yeah, so I think that it's just what I'm learning more and more is uh, like you think about only just like treatment, like
Mhm. Yeah.
giving a patient a treatment, right? But the patient education part is by far the most important because yeah, you're going to correct something, but you want to prevent it from either complicating or recurring. So I think that at least when I was like with physicians prior to getting into PA school, like, yeah, educating them on, risk factors, such as, smoking or things like that, it's incredibly important. And that's sort of what I was speaking to, that I think that type of provider I want to be is that I want to be able to educate my community on the ways we can prevent these things. It's like, at least like I can talk to my parents too, and or like within family, they'll always think it's a problem when it gets to like the later stages. They're like, oh, well, how could this happen? And that might just be stemming from the fact that a provider may not have made that clear prior. So I think sort of moving into medicine where you focus on patient education and preventing or just letting people know of simple lifestyle changes they can do in order to prevent these chronic diseases is incredibly important. And sometimes you can overlook that because obviously you have something in front of you that is tangible and you see that you want to fix. But again, it goes back to preventing it from recurring or complicating. Yeah.
So, undergrad can be rough sometimes, and a lot of people feel like giving up at a certain point. But what got you through these difficult times, and how did you manage to stay motivated and keep moving forward despite any obstacles from undergrad or the application of PA school itself?
Yeah, I think it's like having a good support system. That you have your reasons for why you're doing something. Healthcare isn't it's not like all all glory all the time. It takes a lot on you. It takes a toll on you, and the fact that you're probably already working and then having to deal with applications and things like that, it's gonna be it's gonna be tough, and like there's gonna be very, very hard days, but you move past it just by thinking about why you're doing it in terms of whether it's your family, whether it's your community, whether you've seen health disparities and you want to make the change. I think that motivations like that really keep you going. And yeah, undergrad is hard as well. It's like you're gonna be hit with a lot of different issues, whether it be, grades you get or the classes you have to take and being able to manage multiple different things like school and work. Um, Time management becomes a huge part of your life, but you're set on a goal and a reason why you want to achieve it. But it's the people around you and the support system that really get you through it. And even currently now, it's like a lot of my classmates, it's like they want to dissociate and they go home to families and you just get a reset. Like you spend so much of your time either in school or just like looking at pathologies and different disorders that like you need a little bit of you need to dissociate and like look at yourself as to why you're doing it because it just ends up like everything becomes like one and it's like that's your whole life. But like for me, my whole family is in Pakistan, and if you're coming here for education purposes, it pushes you to like, I'm doing this for certain people, or I'm doing this for a certain reason. Like you've put a lot of work into it and you want to put yourself in the best position. Um, and I think that's sort of what got me through it. And during undergrad, it's like I didn't have like the most amazing like record. Like, I was through ups and downs too, but it was other friends that I had that were doing similar things or other friends that were in going as a pre-med. And, it's their support that allowed me to be like, okay, it's okay. Like you can move past it and having the ultimate goal in your head, um, it makes like getting over little disturbances a lot easier. Like you need to tell yourself like why you're doing it, whether it's your family, your friends, or community, or genuinely trying to make a change within healthcare. I think that's how you navigate that.
Have two more questions. Going back to your extracurricular work that you did during your undergrad, such as medical assistant and the company you worked for, how did you go about applying to them? Because getting these extracurricular jobs is kind of difficult when it's competitive and there's multiple students applying to them. Was there anything that made you stand out, or was it something that was easier for you to get in because not many people knew about it?
Yeah, so I think it's sort of hinted just a little bit to it, where during COVID is when I actually got the first position with Dr. Uche, but that was after, applying for months for everything and anything. It's like I just sort of wanted my foot in the door. Um, I think that's you look at your I think like Hunter has like some listserv and things like that where they send out opportunities, that's where I found the opportunity I have, but you can cold call uh, like clinics. You just need to reach out to as many people as you can, and it's about getting your foot in the door and then uh, excelling just for the physician and showing them that you have the qualities, and it sort of spirals from there. I don't know, it's a weird way to explain it, but it's like you make yourself someone that is trusted, and you can move up in responsibilities. And I think that getting the first position with Dr. Uche was extremely difficult. Like it took a long time, but that was just applying to anything and everything that I saw. Not being like picking up about like what I wanted, because wound care isn't all that glorious. It's and Dawson could tell you, it's just we've almost had people pass out as well. So it it takes a kind of person to be in those positions, but you can apply. You can I also used to go to clinics and I'd be like, hey, like, you guys are looking for a receptionist. I don't know. Just have had friends who were receptionists and then they became medical assistants, and they kept going up from there. You can do certifications. So I got EKG and I did certifications in phlebotomy. Through those, it's still going to be tough because there's a lot of people doing them, but you you need to be able to just make yourself stand out. I think that when you make yourself available and you make yourself present yourself, in their best interest, then that's sort of the way to go. Um, but from there on, like once you get your foot in, it does get a bit easier. And I think that going into organizations, speaking to different people within charge, just like people within organizations. Like when I used to work for NMDP, I found people from there, going into nursing homes or hospitals, or just emailing physicians, um, emailing clinics, and you can sort of do that, or cold call the clinic, just see if they're looking for someone. Look through Indeed. There's websites and things like that that you can continuously monitor, have something on notifications, and yeah, you approach it that way. But you're trying to put yourself in the best position again for this as well, and that's through like um your commitment to healthcare. Like you show that like you want to do this, you want to do the job, and that goes through like certifications and things like that.
Thank you so much for that. And going back to how you were talking about diversifying your work experience, how when Ivy asked you the question, how, some PA students that worked at a dermatology office, they went through their dermatology clinicals like easy. As someone that wants to go into emergency medicine, if I was given the opportunity to, work at a dermatology office or like a different medical profession, I guess, like work at one of their offices, should I take it or look more closer to my goal? Like look into other options, or should I take the diverse work experience?
Yeah, no, I think you should definitely take, every opportunity that sort of comes to you. And like, I mean, I didn't start off wanting to do wound care or anything like that. I didn't even know that was essentially a thing that you do. But you take you it's not about taking whatever you can get. It's about like you're still learning so much within that practice. Like you can't just like expel that. Like that is a great experience. Dermatology has so much that you can do, and like every single specialty will teach you something that will eventually help you. It's things like emergency medicine. Obviously they're very broad in the things that anything can come through the door. You have no idea. But that doesn't discount other specialties. You just take you make what you can out of it. It's not you're not limited. Obviously, these are physicians you're working with. These are like licensed professionals, and they have a lot of knowledge. They're not limited in what they can teach you. And you're supplementing yourself if you genuinely want to learn. um you can you're supplementing that on the side with where you want to end up. But it's about taking every opportunity, and then also uh trying to pursue what you want to do. So you're continuously looking for positions, but every job will teach you something, and you might not even expect it. Like just there's people who have come in for wound care, right? they just want to get their foot in the door, but it's like then they realize they don't want to do it. I mean, that's also a plus. Like you're learning that you don't want to do something, but if anything you do in healthcare is going to teach you how to talk to patients, and that goes across the board for any specialty. You know, the fact that you're able to just get comfortable with patients in any setting will help you. So obviously you want to pursue what you want to do. You want to look through it. You want to know, because that'll tell you if you actually want to do that thing as opposed to this. So yeah, take every opportunity you can. You're not tied down. You learn as much as you can from one position, and if another opportunity comes, you take it from there.
Okay, I have a question. So
Mhm.
you mentioned applications like being a scary time, and that's something I resonate with as a current med school applicant because of like, the uncertainty and wanting to represent your experiences and your motivations well because you care about. So, and one of the most like daunting or stressful aspects for me is interviewing. So, how did you prepare for your PA school interviews? And do you have any like advice to help calm your nerves before an interview? Or
Yeah, absolutely. So, um, I don't really remember what I did, but it was because of like what we were just talking about. It was because of the experience of like talking to patients and talking to doctors, like Dr. Uchi and all the physicians I work with. It's like you build up this like ability to actually have conversation with, different professionals, providers. Uh, we've actually had people who've worked on the team with us in wound care where they were trying to get into PA school or just like, prep for med school, and I've done interviews for them. Like, I've written down a few questions and things like that. And I think the biggest thing is that you it's nervous because you haven't really spoken out these things. So what I used to tell some of the people was like, just get on Zoom and just do an interview. Just like you need to be able to speak. Have a friend just like get on Zoom with you, ask you questions, and be in that professional setting of like, okay, um, these are the questions I'm getting, and then you answer those questions. You need to have like, at least for PA school, like you need to have YPA. There's certain questions that like, across the board, every program is gonna ask you. So, why you want to be in medicine, your weaknesses, strengths, and things like that. These like common points. You just get online or like you get in front of a person and you speak them, because I promise you, in your head, when even like now, like when I think that's one of the things I did is like I actually spoke my answers out. Like I physically, because in my head, like obviously I can make whatever I want, but speaking it is like I had a friend who was doing an interview. It's like he didn't even realize it, but like after every word, he would be like, It's like those little nuances, like you don't necessarily know you do them, but somebody else will be able to pick that up. So when you're prepping for interviews, have someone or talk with someone like physically in a position or get on Zoom and give them questions that they should be asking you, and you practice it, but you have to speak these things out and prepare yourself that way. But you'll be fine. It'll be great.
Thing you said. I just want to, as we wrap things up, I just want to ask you like a little fun topic. So now that you're done, almost like seeing the didactic year, you've been in the classrooms, and now you're hopefully going into your clinical rotations, right? So, is there any type of specialty that you personally want to go into that you were dead set on, or is it still like you're still exploring, or things might change once you see those rotations?
Yeah, I think it's definitely going to change. Like what I was speaking about before was that like I like a lot of things, and I just like I'm very interested in a lot of different things. And we've had a lot of people like different physicians come in. So like they specializing in like internal medicine, or we've had orthopedic surgeon come and teach us like the uh like a musculocutaneous module. I was always interested in cardiology, just again because of like my community and the things like that I've seen within my community. But I can I was because of the people that have come in to teach, like I've been very interested in internal medicine or emergency medicine as well. So, we have a PA here who is she's a emergency medicine PA, and I really like the way she teaches, her day-to-day and things like that. So from people within our upper cohort, so like our seniors, they've also said the same thing. Like that's the importance of like the clinical rotations, is that you end up learning what you want and what you don't want. But yes, for now it's cardiology, but yeah, it could definitely change. Yeah.
Yeah. So I think that wraps up most of the questions that we had and all the questions that we had. So I really want to give a big shout out to Abdullah. Right now he's in PA school. I came out of on Sunday to do this for us. So like, thank you so much for taking the time to speak with us and to like share your journey about your experiences and your whole pre-PA journey as well. So we also really appreciate the openness and everything that we heard in this panel. It'll be available for many people to listen in afterwards as well. You can find us on YouTube, TikTok, and any of the socials. So what we learn and discuss here will be valuable for students, the importance of clinical experiences and how healthcare can basically be used to give back to one's community. And I think with that in mind, thank you so much, Abdullah. And follow us on all of our socials on Pathio.
Yeah, no problem, man. Thank you guys for
Thank
having me.
you. Mhm.